My name is Stephen Ritland, and I help people get better. It's interesting. The first thing you learn when you do my business is that surgery doesn't make an unhappy person happy, but you can help them with. I help them with structural issues, and they can be a lot better. But people that want to get better get better. Disability is mental, not physical. I see lots of people with significant issues that they're not the least disabled. They might hurt and they might not be able to do some of the things physically that we do. Surgery makes things different, not normal, but surgery can make things in many ways a lot better, and you set things up for people's recovery. You know, my life is, I'm a neurosurgeon, mostly at work. You know, it's nice to escape to the mountain and get outside, but you know, my schedule is fairly demanding from a workload, so I spend more of my time here than I probably should. There's a limit to how much you can do in a day, and my world is a fairly linear world where you do one thing at a time. It's hard to keep up with everybody that wants to come in, if you will. I get reminded periodically that I can't necessarily accomplish as much as I want. And I apologize to patients in advance for not being able to necessarily see them as soon as I should. You know, I started back in the 90s doing a minimal access approach to the spine, and I was using homemade instruments, and because of what I was doing, Flagstaff developed into a significant surgeon training center. I mean, I've had surgeons from all over the world visit, and that was unexpected. It's not something I anticipated moving here, that I would have that kind of opportunity. The interesting thing about spine is, in many ways, it's the most demanding thing that we do, because you've got to fix a problem in a dynamic system where you want a durable outcome for, you know, 20, 30 years or more. You want a long-term fix, and it's not easy to get consistently good results in that area. It remains as demanding as anything I do, and it's just trying to meet those demands. It helps to have 40 years of who you might have treated differently. And you look at things based on those 40 years. You know, the older you get, the more you appreciate boring surgeries. You don't necessarily want to have challenges that come up that really test your skills. It's nice when things go smoothly and there's not things that are unexpected. Realizing that patients have a way of providing us with challenges on a regular basis that you've got to think through and try and sort out a solution. There is that issue that in surgery, once you start, you've got to figure a way out, and it's not always as simple as you think it should be. But it's nice when you're able to complete your surgeries and get done what you need to do. And I think I do it as well as most. Realizing that I still have days where it's interesting.